I think that the future of cosmetic surgery still will always rely on the physician. I don't think we'll ever be replaced. There are robotic aspects of cosmetic surgery, all these new lasers that are really, really neat. But I don't think we as physicians will ever be replaced in the day-to-day care. I mean, these devices are great, all the toxins and fillers are great, but we still need to be involved with what you need, how it's done, and how you're cared for. Some of the things that are really exciting, though, are some of the stem cell things that are coming out, exosomes, being able to clone organs, clone hair, where people who want to have hair transplants, maybe one day we'll be able to clone a single hair and we'll have enough hair to do a complete hair transplant. And so the limitations that we have sometimes with fat grafting or with hair transplants or tissue grafts, I think in the next 10 to 20 years, we'll probably see most of that go away. So I think in physician involvement in patient care in this cosmetic surgery world that we live in is so important.